Assalamualaikum. Very good morning to you all. This is Dr. Farhana Siddique, lecturer, Department of Community Medicine in Bashundhara Ad-din Medical College. Today I would like to talk about hypertension. At first, we know about what is hypertension. Hypertension, it is also known as high blood pressure. It is a long-term medical condition in which the blood pressure in the arteries is persistently elevated. The systolic blood pressure will be more than 140 mm mercury and the diastolic blood pressure will be more than or equal of 90 mm mercury in case of hypertension. Now, types of hypertension. At first, pre-hypertension. In pre-hypertension, systolic blood pressure within 120 to 139 mm mercury and diastolic blood pressure within 80 to 89 mm mercury. And in hypertension stage 1, systolic blood pressure within 140 to 159 mm mercury and diastolic blood pressure within 90 to 99 mm mercury. In hypertension stage 2, in systolic blood pressure is more than or equal to 160 mm mercury and diastolic blood pressure more or equal 100 mm mercury. Now, etiology of hypertension. In primary hypertension, it is the elevation of BP without any identified cause, and in secondary hypertension, the elevation of blood pressure with an exact cause. The cause of secondary hypertension includes congenital narrowing of aorta, renal disease, endocrine disorder like Cushing syndrome, neurological disorder like brain tumor and head injury, sleep apnea, medication like oral contraceptive pill, NSAID and cocaine, cirrhosis of liver. Now, risk factor of hypertension. Age is the first risk factor in case of hypertension. More than 50 years of age is more susceptible for hypertension. Alcohol, smoking, diabetes mellitus, excessive dietary intake, gender, family history, obesity, sedentary lifestyle, stress is the risk factor of hypertension. Now, pathophysiology. The normal blood pressure is maintained by 4 mechanisms. First is sympathetic nervous system activities, second is activities of vascular endothelium, third is activities of renal system, and last on activities of endocrine system. Now, sympathetic nervous system activities. When the blood pressure is decreasing, the activation of systemic nervous system will occur. The increased sympathetic nervous system activity increase the heart rate and also cardiac contraction. The net effect of sympathetic nervous system activation is to increase the arterial blood pressure by cardiac output and systemic vascular resistance. Blood pressure equal to cardiac output and sympathetic vascular resistance. Activities of vascular endothelium. The vascular endothelium is a single cell layer that lines the blood vessel. It will produce vasoactive substance and growth factor like nitric acid and endothelium. These substances are potent vasoconstrictors and causes increased blood pressure level. This is the diagram showing the activities of renal system in case of maintaining the blood pressure. Now, activities of endocrine system. When the angiotensin II is stimulated in the adrenal cortex, it will secrete aldosterone. The aldosterone will stimulate the kidneys to retain sodium and water. Thus, the blood pressure and cardiac output will get increased. Now, clinical features of hypertension. It is also known as a silent killer disease. In some patients, the symptom will develop like severe headache, blurred vision, dizziness, nausea, vomiting, fatigue, confusion, chest pain, shortness of breath, irregular heartbeat and papilledema. Now, diagnostic evaluation. History collection and physical examination, medical history of diabetes mellitus, complete blood count, chest X-ray and ECG. Management. Mainly, the management of hypertension is possible by 2 ways. which include lifestyle modification and pharmacological therapy. Now, lifestyle modification. The lifestyle modification includes mainly weight reduction, DASH diet, which means dietary approaches to stop hypertension, dietary sodium reduction, reduced alcohol, exercise and stress management. Now, pharmacological therapy. Various groups of drugs are used for the treatment of hypertension. Collectively, these drugs are called as antihypertensive drug, which includes diuretics. It helps the kidneys to inhibit the sodium reabsorption so that blood pressure is reduced, such as furosemide, beta blockers. This medication reduces the workload of the heart and blood vessel and causing the heart to beat slowly with less force, such as atenolol and propanolol. Alpha blockers. This medication causes the peripheral vasodilatation of the blood vessels like prazosin. Vasodilators. This medication acting directly on the muscles of the walls of arteries and preventing the muscles from tightening and arteries from narrowing, like nitroglycerin, sodium nitroprusside, etc. ACE inhibitor. This group of medication will reduce the conversion from angiotensin 1 to angiotensin 2 and prevent vasoconstriction. Example, captopril and ramipril. Calcium channel blockers. This medicine will block the movement of extracellular calcium into the cells and causing vasodilatation and decrease the heart rate. That's why blood pressure also decreased, like amlodipine and verapamil. Alternative therapies which are helpful to regulate blood vessel include relaxation technique and diversional therapies. Now, nursing management. Proper history collection should be done, which includes family history also. Dietary habits should be assessed. Identify the medical history such as diabetes mellitus, renal disease, etc. Instruct the patient to avoid smoking and alcohol. Auscultate heart rate and palpate peripheral pulses. Identify the use of medication like oral contraceptive, steroid, NSAID, etc. Monitor vital signs frequently. Provide diet which is low in sodium but rich in fruits and vegetables. Monitor the blood cholesterol level frequently. That's all for today. Thanks for your patient hearing. Allah Hafiz.